Good morning, everyone. My name is student Hamito, your student nurse. For today, I will be demonstrating the different body positions. Body positioning is vital for a safe and effective surgical procedure. It depends on the type and length of a procedure, anesthesia access to the patient, devices required, and other factors. The main objective of body positioning is to maintain body alignment, maintain skin integrity, provide comfort, and maintain optimal positions for ventilation and lung expansion.
Raise the level of the bed to comfortable working height. Remove all pillows and devices used to previous position. Check for availability of assistive devices, wash hands, and explain the procedure to the patient.
First is supine position. Supine position is frequently used on procedures involving the anterior surface of the body, which includes the abdominal, cardiac, and thoracic area.
Instruct the client to lie on his or her back with legs stretched out together. Place a pillow under the head. Place the arms at the patient's side with hands pronated.
Second is the dorsal recumbent position. We use this in physical examination, which includes the rectal, genital, and vaginal area. We also use this in surgical operations, drawing blood, running IV lines, bladder draining, and giving birth.
Instruct the client to lie flat on his or her back in a supine position, with the knees bent and legs slightly separated. The soles of the feet should be flat on the bed. Let the arms rest in a way that is comfortable to the client.
Third, lithotomy position. Lithotomy position is applied during childbirth and surgery in pelvic area.
Ask the patient to lie on his back, separate knees, and flex thighs deeply towards the abdomen. The lower part of legs and feet are brought upward, feet are lifted off the table and placed in stirrups. Let the arms rest in a way that is comfortable to the client.
Fourth is the sideline position. The sideline position may be used in some patients with mild forms of sleep apnea, in some patients with dysphagia, and in patients predisposed to sacral decubitus ulcers. It could also use in breastfeeding and to ease pain pregnancy.
Instruct the client to lie on his or her side, either on the right or left, with the head supported on a pillow. Undertuck a pillow along the client's back. Bring the underlying arm forward and flex it on a pillow used for the head. Bring top arm forward and flex it and press it on a pillow in front of the body. Flex the client's upper non-dependent leg to a right angle. Let the client extend his or her lower dependent leg. Place a pillow under the knees and foot. Check the client's proper body alignment.
Fifth, Sims position. Sims position is used for rectal examination, treatments, enemas, and examining women for vaginal wall prolapse. It also prevents aspiration of fluids and reduces lower body pressure.
Instruct the client to lie on his left side with the cheek resting on a pillow placed under the head. Let the client turn far enough onto the abdomen. Extend the lower arm behind the back and flex both knees lightly. Let the other arms rest in a way that is comfortable to the patient.
Sixth, Prone position. Prone position is the only bed position that allows full extension of the hips and knee joints. It also helps to prevent flexion contractures of the hips and knees. In surgery, prone position is often used in neurosurgeries and in most of the neck and spine surgeries.
Instruct the client to lie flat on his or her abdomen with the head turned to one and resting on a pillow. Place the client's arm at the sides or bent at the elbows.
Next is the knee chest position. The knee chest position can be lateral or prone. This position is usually adapted for sigmoidoscopy without anesthesia. For some patients, this position can be embarrassing, so we should observe privacy and proper draping. The knee chest position is assumed for gynecologic and rectal examination.
Instruct the client to kneel on the bed or on the examining table. And then lean forward with the hips in the air and the chest and arms on the bed or table. Place a pillow under the client's head with the head turned to one side.
Next, Fowler's position. Fowler's position is used for patients who have difficulty of breathing, also used for patients who have cardiac, respiratory, and neurological problems. Also used for patients who have nasogastric tube in place. This position also prepares patients for walking, also helps patients who have poor neck alignment, and in some surgeries, which includes neurosurgery or the shoulder.
Place the client in a supine position with the head of the bed elevated to angle of 25 degrees. Place the client in a supine position with the head of the bed elevated to angle of 45 degrees. Place the client in a supine position with the head of the bed elevated to angle 70 to 90 degrees. Trendelenburg position. Hypotensive patients can benefit from this position because it promotes venous return. It is used to provide postural drainage at the basal long lobes. For the procedure, we check the availability of the bed straps to be used to prevent the client from slipping off the bed. We remove the pillow from the head part and place it at the edge of the bed. We place the client flat on his back. The head of the bed is lowered at 30-degree angle below horizontal level. Reverse Trendelenburg position. This position is often used for patients with gastrointestinal problems as it helps minimize esophageal reflux. It also prevents rapid change of position and promotes stomach emptying and prevents reflux for clients with hiatal hernia. For the procedure, place the client flat on his or her back with the headbed elevated to an angle of 30 to 45 degrees above horizontal level. Check the availability of bed strap or restraints.
Lastly, the C-curve position. The C-curve position is used in the assessment of the posterior portion of the body and of the spine. This position is used to inject anesthesia into a cesarean patients.
Let the client assume a fetal position with the knees and arms together. The chin should be touching the chest.